Um, so thanks everyone. I'm Samuel Breau, and the topic today that I'll cover is looking at housing, mental illness, and problematic substance use, and the idea of bridging housing in the context of healthcare. And so before I start, I would like to acknowledge that I'm currently based on the unceded territory of the Anishinaabe people, which today is known as the La Pêche region, which is about half an hour north of Ontario, Ottawa on the Quebec side. During the course of my practicum, I actually relocated temporarily and live on the Mi'kmaq territory, which is the Miramichi area of the province of New Brunswick. And so my practicum took place with the Department of Health, Mental Health and Addictions branch with the province of New Brunswick. And so I will be forever grateful, honestly, to my supervisor, Bernie Gogan, who is the director of the Mental Health and Addictions branch. Truly grateful for all of the support and guidance from Dr. Nigel Livingston, as well as Dr. Victoria Barr. I'm also grateful to Dr. Karen Urbanowski, who was second reader and provided some really great comments, as I tend to be an overly concise person. But then moreover, I also want to acknowledge the support that I've had since 2013. That's when I started my master's from Betty Taylor and others at the School of Public Health and Social Policy, namely Joan and Jillian, as they helped me navigate the academic bureaucracy to ensure that I could continue being mentally well or get back to wellness as I lived through some setbacks. And so I'm hoping today to cover a little bit about my practicum. I will frame the issue, and you'll notice that I might not share all of the details of the findings, as the core project that I worked on ultimately ended in an internal discussion paper that will inform the future work of the Department of Health as it looks at ways to better support the housing needs of people living with mental illness and or problematic substance use. And so my practicum with the Mental Health and Addictions branch had various components. I worked on the implementation of a public health model based in Iceland, the Icelandic model of substance use prevention for youth. I also looked at housing in the context of people living with mental illness and substance use. And I also contributed to looking at needs-based planning in mental health care and services, and was excited to see that there's an integration of a public health approach looking at upstream prevention as well in the context of mental health care and service delivery. But enough about that. I'll focus on the internal discussion paper. And so for this, the goal really was to provide some insights about the current context related to healthcare delivery, but also at the housing needs gaps for people living with mental illness and substance use. And so this also connects to the province's recently launched mental health and addiction strategy, which also incorporates an upstream component to looking at housing. And so before launching more formally into this work, the department wanted to have a better sense of, where do we start? What are some starting points? But also to connect with some stakeholders. And so the paper was built on a mix of methods that included a literature review. The sources included Google Scholars, as well as academic databases provided via the University of Victoria's library. I also conducted an ongoing media scan over the period of 3 months, 3 or 4 months now, with my practicum. And so this was set up in a daily scan furnished via Google, where I would get all sources available in Canada from across the country to look at anything related to housing, homelessness, shelters, poverty, mental illness, and substance use. And then followed this exercise with a qualitative interviews with about, I believe, some 20 different stakeholders that included frontline service providers, housing advocates, and people with lived experience, peer supporters, as well as a cross-section not only focused in healthcare, but also looking at people that are receiving care in a correctional setting. Finally, I also conducted a jurisdictional scan to start identifying practices that could be implemented in the province. And so it wasn't necessarily identifying all of the practice, but rather applying a lens that filters political, financial, and other considerations in terms of the likelihood that the initiatives being explored could be implemented in the province. Ultimately, why are we focusing on this? And in a nutshell, the core of the issue is that we, in many jurisdictions, and this is not only limited to New Brunswick, models of care focus on a treatment-first approach and tend to leave out housing components. And so, and we'll get further into this in my presentation, but the idea that somebody cannot be mentally well if they don't have housing. So if we take a step back just even a decade ago, we used to, and we still do, but less and less now, only think about physical health. And now we recognize that it's about the whole person, both physical and mental health contribute to overall health. But what does that look like if you don't have a house? What does that look like if not having a house leads you into traumatizing environments that could expose you, for example, to having to use substances in order to survive? And so I will not get into all the details in my presentation, but we can see that there's an intimate connection between housing and the determinants of health. In the last 3 decades, and Dr. Trevor Hancock recently released, I think, kind of the thesis that I was building on this. We have a perfect policy storm that leads to the current housing crisis that also intersects with the drug crisis in Canada. And so over the last few decades, we've seen a decrease in investments in housing policy with reductions in healthcare spending, welfare policy spending as well. The economic policies have generally continued to increase the poverty rates or increase the gap between rich and poor. And then this also connects with pharmaceutical and drug policy that has simply created a perfect storm where people are increasingly facing homelessness. Buying a house is increasingly out of reach. And the way that the drug policies are being administered do not lead to harm prevention, for example. I'm oversimplifying in this presentation because I'm trying to connect a lot of dots, but this is kind of the overarching context. So in the literature, there's a lot of discussion about what causes mental illness and substance use in the context of homelessness. Is it one that causes the other? And in fact, there's plenty of evidence that demonstrates that facing homelessness can increase your likelihood of developing a mental illness or substance use issue. And conversely, if you have problematic substance use and chronic mental illness, you could be at increased risk of facing homelessness. So without going into the details, there's many, if not most of the social determinants of health that contribute to influencing a person's likelihood of facing homelessness. And the impacts are felt across the social ecological model. So not only individually, but it impacts relationships, it impacts communities, it impacts societies. And ultimately, if we don't pay and invest in proper housing, we'll pay for it through unfortunate consequences, including quality of life and others. In the current context that I provided for the province, as I mentioned, we looked at scanning public opinion via the media scan, as well as through stakeholder pulse check interviews, was able to get a better sense of how people on the ground are feeling, and ultimately looked at some practices that could be implemented in the province. As I said, I can't go into the details of the finding per se, but most of the recommendations that were developed are consistent with literature and others that are being considered in other jurisdictions. in a nutshell, I recommended that that the province consider better horizontal coordination across social development, which is responsible for housing as well as healthcare, and consider getting into the business of housing, which is the idea that when someone leaves treatment, you have to look at their housing, or else the treatment is likely to have failed or will fail if housing is not provided towards after the transition. I note that I am out of time. And so I'll just go into the last slide to say that the core issue that's being faced is about bridging transition gaps. And so bridging the gap in housing going into care and out of care. And that's likely what the province will be focusing moving ahead. As you'll see, I started with a very broad topic. I could have written a PhD doctorate, so I had a huge challenge ahead of me, but I hope that I've given you a sense of the issues being faced and some of the things that I learned during my practicum. Thank you.